Let's talk about something that sounds, well, kind of impossible. A successful surgery that actually leaves someone in more pain than they were in before. It's a true paradox, but for so many people who've gone through back surgery, it is a very frustrating reality. Today, we are going to play medical detective. We're going to uncover the hidden culprit behind this whole problem, and it all comes down to one tiny muscle that holds the key. If this sounds like you, listen up. You did everything you were supposed to do. You trusted the experts, you went under the knife, you pushed through the rehab. But instead of that sweet relief you were hoping for, the pain is still there. I just want you to know you are not crazy, and you are definitely not alone. There is a real biological reason for what you're feeling, and it even has a name. It's officially called Failed Back Surgery Syndrome, or FBSS for short. And that name is a little misleading because it's not really about the surgeon failing at their job. We're talking about a surgery that, from a technical standpoint, went perfectly. So if the operation was a success, why does it still hurt so much? That is the million-dollar question we are going to crack today. All right, so here's the central mystery. How can a procedure designed to fix a problem actually, in some cases, make it worse? Well, the clue has been hiding in plain sight this whole time, in a place that, frankly, often gets overlooked: the muscles surrounding the spine. To really wrap our heads around this paradox, we need to meet a true unsung hero of your back. It's a small but mighty muscle that is absolutely key to a strong, stable spine. But here's the tragic twist. The very surgery that's supposed to help often ends up accidentally harming this crucial player. The name of this muscle is the multifidus. And I really want you to remember that name, because by the time we're done here, you are going to understand exactly why this tiny, deep muscle is the key to unlocking the whole mystery of post-surgery back pain. Okay, so what makes the multifidus so special? Look at this. It's not one of those big, bulky muscles you use for heavy lifting. Nope. It's a whole series of short, powerful little muscle bundles tucked deep in your back, right up against the spine. The best analogy? Think of the guy wires on a massive radio tower. They aren't the biggest part of the structure, not by a long shot, but without them providing that constant, fine-tuned stability, the whole thing would come crashing down. That's the multifidus for your spine. So you can think of the multifidus as the ultimate micromanager of your spine. Its job isn't about making big, sweeping movements. It's all about those countless, tiny, subconscious adjustments that keep your spine stable and safe from moment to moment. Every time you bend, twist, or even just stand up, the multifidus is there, firing away, making sure every single vertebra stays exactly where it's supposed to be. So if this muscle is so incredibly important, how does it get damaged during a surgery that's meant to help? Well, let's step into the operating room, because unfortunately, it can become the scene of the crime against this vital muscle. During a standard posterior lumbar surgery, there are basically three major threats. First, just to get to the spine, surgeons often have to detach the muscle from the bone. Second, they use tools called retractors to pull the muscle aside and hold it out of the way. But this can literally choke off its blood supply. That causes something called ischemia, which is just a fancy word for tissue being starved of oxygen, and that can lead to necrosis, where the tissue actually dies. And third, the single delicate nerve that powers the muscle can get easily damaged in the process. And this isn't just a theory. Check this out. A clinical study found a direct, measurable connection. The longer that muscle is pulled back by retractors, specifically once you cross that 80-minute mark, the worse the outcome for the patient. We're talking more pain and a much, much slower recovery. It's a stark reminder that in surgery, time is literally muscle. Okay, so the multifidus gets injured during surgery. What happens next? Well, your body, being the amazing machine that it is, immediately kicks off the healing process. But here's the plot twist. The very same process that's designed to heal you can sometimes become the source of your chronic pain. It is a classic double-edged sword. I love this analogy. Think of your body's immune response like a construction site. The first ones to show up are the M1 macrophages. This is your demolition crew. They rush in, create a lot of inflammation, and they aggressively clear out all the damaged tissue. Then, once the site is prepped, the M2 macrophages roll in. They are the rebuilding crew, and their job is to promote repair and remodel the tissue. For a successful project, you need both crews, and they have to work in the right order. The actual rebuilding is done by these incredible little things called muscle satellite cells. They're basically stem cells that live in your muscles. They just hang out, dormant, until an injury acts like an alarm clock and wakes them up.
They then start multiplying, they specialize, and then they fuse together to create brand new, fully functional muscle fibers. It's an absolutely remarkable process. And this is the absolute key to the entire mystery. What happens if the demolition crew, those pro-inflammatory M1 macrophages, stick around for too long? Well, they get in the way, and the rebuilding crew can't do its job properly. This state of chronic inflammation basically short-circuits the whole healing process. So instead of getting healthy new muscle, you end up with scar tissue and atrophy, and that is a direct path to chronic pain and instability.
So we've seen how the surgery can cause the damage and how the body's own healing response can sometimes go haywire. It might sound a bit bleak, but I promise you it is not a hopeless situation. There are absolutely ways to heal this vital muscle and get back on your feet. The answer seems to lie in an integrative approach, one that combines the best of both modern and traditional medicine. This chart gives us a fantastic bird's-eye view. Over on the Western medicine side, you've got the familiar stuff, right? NSAIDs, like ibuprofen, to calm down that inflammation, muscle relaxants to deal with spasms, and of course, targeted exercise therapy to rebuild strength. Then you look at traditional Chinese medicine, and you see things like acupuncture to help modulate pain and even promote repair, and herbal formulas to improve blood flow. The idea is to attack the problem from every possible angle. So, zooming in a little, the Western game plan usually starts with managing the immediate symptoms, using medication to get inflammation and those painful spasms under control. Then comes the real work, physical and exercise therapy that is specifically designed to wake up and patiently rebuild that damaged multifidus muscle.
Now, here's where it gets really fascinating. Traditional Chinese medicine brings a whole different toolkit to the table. We're talking about ancient techniques like acupuncture, which modern studies have actually shown can help your body create those new muscle satellite cells we talked about. There are also specific herbal formulas that can improve circulation and cut down on the inflammation that's causing all the trouble in the first place. Okay, we've gone deep into anatomy, injury, and healing. So after all that, what is the big takeaway? What's the one thing you really need to remember from all of this?
It's really simple, but it's also incredibly profound. That tiny multifidus muscle is not optional. It is absolutely indispensable for a healthy, stable spine. And for both patients and surgeons, just understanding how vulnerable it is during surgery, that alone is the critical first step toward breaking this painful cycle and getting better outcomes. So what does the future of back surgery look like? Well, it's not just about fancier robots or new kinds of screws. The real revolution is going to be in how we approach the muscles. The future is about surgery that isn't just successful in a textbook, but is actually successful for the living, breathing patient. And that means doing everything possible to protect the multifidus from the very beginning. So I want to leave you with this. The next time you hear about someone having back surgery, maybe we can start asking a different question. Instead of just asking, did the surgery fix the bone? Let's start asking, did the surgery protect the muscle? Because the answer to that second question could mean the difference between a life of chronic pain and a life of freedom. The future of back surgery and the well-being of millions of patients really depends on it.